Okay. Good afternoon. Good afternoon, everybody. It's your favorite family physician, Dr. Edified. So, I don't know how many of you are joining in right now, but this is a follow-up to the post I had made earlier concerning the 10 tips that every woman should do before getting pregnant. Yes, I had posted something some days earlier, and it was about the things that every woman must do before getting pregnant. Now, basically, these tips are important because especially for married people that are planning to get married, because in our setting, most people, once they are married, the next thing on the mind is they want to start having kids, and as a result, the wedding night usually comes with expectations. The 2 months later, 2 months after the wedding day, one is expected to have missed a period or to have tested positive for a pregnancy test. So usually there is no time to sit back and plan one's life and do those things that I mentioned earlier. Especially some of those things should have been done like a month ahead of conception, a month before getting pregnant. So it's usually advisable. I recommend women do this even before getting married, like while you're preparing for the wedding, or when you're sure, you're convinced, or you have a conviction within your spirit that you want to get married within a certain or at a certain time. Then prior to that time, these are the things that the woman should do. So now I just want to highlight each of those things that I said. I want to talk further on them for better understanding, so you can have a deeper understanding on why these things are important. I'll start with the blood group. Blood group is, we have about 4 blood group types. Scientifically, there is the blood group A, B, AB, and O. These blood groups in itself is not what we are focused on. Rather, it is the positive aspect. There is another component of blood group that we call the rhesus factor. It's either plus or negative for any of these 4 blood groups I mentioned earlier, and as a result, a woman, the plus, the rhesus positive blood type is more common, is over 70% of the population. However, there is a subtype which is the minus, the RH negative. So one could be A minus, B minus, O minus, or AB minus. The same way one could be A plus, B plus, AB plus, and O plus. So the positive rhesus group really don't have an issue. They are not the group we are talking about here. Is the ones with the minus. Those ones are actually few. They are not common. So it's important to check if you're among the few special people that have the negative rhesus factor, or that are negative for the rhesus factor. It's important because if a woman who is rhesus negative conceives the baby, or conceives with a man who is rhesus positive, there is what do I call it now? There's a reaction that we call the rhesus isoimmunization, where in subsequent pregnancies, assuming the first pregnancy was successful, the woman becomes sensitized. So in subsequent pregnancies, the woman begins to develop antibodies against foreign cells, against those positive cells, which is from her husband that is positive, okay, against the fetus. Usually the fetus would read positive from the father. So the woman begins to fight these cells or this fetus, and this results in an early miscarriage. And subsequent pregnancies, the phenomenon keeps recurring. So a woman who does not know that she is negative for the rhesus factor and has married a rhesus positive husband might have this situation in subsequent pregnancies, and they wonder why they keep having recurrent miscarriages. So this is one of the common causes of recurrent miscarriages among rhesus negative women. It's also important to note, because for most people, okay, you might feel, oh, thank God my husband is rhesus positive. If your husband is rhesus positive, fine, and you're rhesus positive, you don't really have an issue. If you're rhesus negative and your husband is rhesus positive, there's really no eyebrow here. The problem is usually when, sorry, if you're rhesus negative and your husband is rhesus positive, yeah, that's where the issue is. If you're rhesus positive and your husband is rhesus negative, there is really no issue here as well. The problem usually is when you are rhesus negative and you get married to a rhesus positive man. That is when your body, who doesn't have the antibodies, begins to react to the foreign cells that are seen in the body and then cause damage. Next thing of importance is the genotype. Everyone by now knows this, but I'll still talk about it. The genotype, you're either AA or AS or SS or SC. If you are SAS, it's important that you know the genotype of your spouse, because if you marry a man who is an AS genotype, then each pregnancy has a 25% chance of becoming an SS, meaning you would give birth to a child that has sickle cell disease, sickle cell anemia, the ones we call sicklers, who always require blood transfusion, who always have one crisis or the other, and whose management is a lot comes with a lot of economic and financial burden for both the parent, the child, and even the society at large. So to prevent this, what you don't, once you're married, you cannot really go back. Your genotype is a genotype, you can't change it. So it's important to know your genotype as a woman. Okay, I'm AS. Once you know your AS, you know that your male partner has to be an AA. However, if it's an AS, then you have to monitor each pregnancy. Those facilities for that is available, expensive in this country, but is more available abroad. So you carry out investigations on each pregnancy to be sure that that fetus is not of the SS genotype. If it's SS genotype, some couples would opt for a termination of that pregnancy to avoid bringing a child that would be stressed or that will cause stress to the parent. Another important thing one should know is the HIV status, hepatitis status, and cervical cancer screening. Hepatitis and HIV are viral infections that can be treated. They have no cure, but can be treated and can be controlled. Hepatitis has a worse prognosis than HIV. HIV could be in the system for years without one knowing, but if medications are commenced early, the viral load can be controlled, and also it would help to prevent the transmission to the unborn baby. This viruses, by the way, can be passed on to the baby in vitro. Actually, hepatitis, HIV, those viruses can be transferred to the unborn baby. So if you're HIV positive, if you're hepatitis positive, you need to know your status so you don't transfer it to, or transmit it to an unborn child that has not offended anybody. Then the hepatitis is more chronic. It has a worse prognosis. So one with hepatitis, after a while they begin to develop symptoms, and once the symptoms of hepatitis begin to manifest, it's usually difficult to get a cure or to get a reversal. But if it's detected early and treatment is started early, then the condition can be controlled, the infection can be controlled. Cervical cancer screening is important because after marriage, there are some procedures that should not be done while a woman is pregnant and while breastfeeding, because the cervical changes that occur during this period might cause a misinterpretation or might cause a false positive result. So such that cervical cancer screening may not be done in women who are pregnant and who are breastfeeding. And after breastfeeding, most women immediately go for family contraceptive methods, so they lose out the period, they miss on the period that they ought to have gone for cervical cancer screening, so because a woman who is going planning to get pregnant should have done this screening earlier. In developed countries, one of the treatments for cervical cancer is to give the HPV vaccine, and in developed countries this is done even before the age of 15. But in our country we haven't gotten to that level yet, so we can still get there. But you can just help yourself by screening yourself for cervical cancer before marriage. Another important thing is to know your blood pressure, to know your glucose level. These parameters are important. They have implications in pregnancy induced hypertension, which causes women not to be able to carry their babies to term, to 36 and 37 completed weeks. Most time the pregnancy is terminated early, end up having small babies, or babies that are too small to be born, or babies that are born prematurely, or babies that are restricted in utero, and when they are born they have growth issues, problems associated with hypertension, even diabetes. Sometimes they bleed, excessive bleeding. Some women don't make it because of the excessive blood loss and the several changes that this pregnancy induced, that the hypertension does to the system. So some women don't make it, they eventually die because they were not checking their blood pressure. They did not know that they were hypertensive before pregnancy, and therefore there are avenues that we can do to prevent this woman from developing it in pregnancy, or from developing complications in pregnancy. Same thing goes to diabetes. Issue with diabetes is that most of the time they give birth to very big babies, and that increases the rate of having a cesarean section for women who really want to go through birth the natural process. So it increases the risk for cesarean section, because it's not safe to give birth to a very large baby through the natural birth canal. And also the baby that is born might require admission and some other complications that follow babies that are very large birth weight. Another important thing that a woman should do for getting married is to take her supplement. I'm going to end here for today. Is to take her supplement, iron supplements, folic acid in particular. Whatever supplement you're taking should contain folic acid. Folic acid is very important for the development of the neural system in utero while the baby is in the womb. Deficiency of folic acid causes what we call neural tube defect, a situation where a baby is born with a defect in the back where the spine is, like a hole there, and once that hole is there, it means the nervous system is not properly developed, and this will lead to motor function and dysfunctions and sensory dysfunctions as the child grows up. The child may not achieve developmental milestones early because of the nervous system poor formation. So it's important to prevent this, and this, once the baby develops, this is very difficult to treat. So one of the ways to prevent it is just to take folic acid supplements, which will be prescribed and recommended by your physician during your regular antenatal clinic visit. So today, this is where I'm going to stop. I'm going to catch you next time on my YouTube channel or on my Instagram live, where I share more insight on the remaining 5 things a woman must do before getting pregnant. See you. I love you. Mwah. Do I stop?